What everyone should know about cervical spinal stenosis and how to treat it. Hi, my name's Brian Hefflinger. I'm a board certified neurosurgeon. I've been in practice for 26 years. So cervical spinal stenosis is basically narrowing of the spinal canal in your neck. And often people who have stenosis in their neck, they have pinching of the spinal cord. And when you get pinching of the spinal cord, there are certain symptoms that go along with that. So often people will have numbness and tingling in their arms or legs, tingling in their hands and feet. They can have weakness of the hands and often drop things. Other people will say their balance is off, or their legs feel rubbery, or their legs feel like they want to give out. If you have those type of symptoms, you certainly should see your doctor and be evaluated. But there's certain ways that you can treat cervical spinal stenosis. If you actually have a pinched spinal cord, the best treatment for the long term is definitely surgery, because it's a structural problem, right? Your spinal cord is being pinched. And so the only way to unpinch it is to get in there with surgery and unpinch it. Physical therapy, pain management, chiropractors, they may treat some of the pain, but they're not going to treat the underlying problem. So when it comes to surgery, here's what we do. This is a model of the back of the spine, of the bones in the neck. This is the base of the skull right here for reference. So when we do surgery on someone's spine, we actually take the bone off the back of the spine, and so we make cuts through the bone on either side where these black marks are, and then we actually lift the bone right off the back of the spine, and that opens up the spinal canal. Now, some people need to have instrumentation to stabilize their spine, and so we'll put little screws into the joints right where I'm pointing with the pen on either side, and then once you put these screws in, you connect them by a rod, and then that adds support to the spine. But by far, the main goal of this surgery is to unpinch your spinal cord, open up the spinal canal, and keep you safe for the future.